Hello, friends. I hope you all will be fine and doing good. Today, our topic is about types of depression. In the previous video, I have discussed about depression and symptoms of depression in men, in women, and in children, and the causes of depression. The link is in the description. Please watch that video as well. Okay, what are the types of depression? Major depressive disorder, the first one. It is more severe form of depression. It's characterized by persistent feelings of sadness, hopelessness, and worthlessness that don't go away on their own. In order to be diagnosed, you must experience five or more of the following symptoms over a 2 week period. The first one, feeling depressed to most of the days, loss of interest in most regular activities, significant weight loss or gain, sleeping a lot or not being able to sleep, slow thinking or movement, fatigue or low energy most days, and feeling of worthlessness or guilt, loss of concentration or indecisiveness, recurring thoughts of death or suicide. The second type is persistent depressive disorder, which is also called dysthymia. It's a milder but chronic form of depression. In order for the diagnosis to be made, symptoms must last for at least 2 years. It affects more than major depression because it lasts for a longer period. Lost interest in normal daily activities, feeling hopeless, lack productivity, have low esteem. The third one, bipolar disorder, which is also sometimes called manic depression, has mood episodes that range from extremes of high energy with an up mood to low depressive periods. When you are in low praise, you will have the symptoms of major depression. Your doctor may suggest a mood stabilizer such as lithium. The fourth one, seasonal affective disorder. It's a period of major depression that mostly happens during the winter months when the days grow short and you get less and less sunlight. It typically goes away in the spring and summer. If you have seasonal affective disorder, antidepressants can help, so can light therapy. You will need to sit in front of a special bright light box for about 15 to 30 minutes each day. The fifth one, psychotic depression. People with psychotic depression have the symptoms of major depression along with psychotic symptoms such as hallucinations. Saying hallucination means saying or hearing things that are not there. The second one, delusions, means false beliefs. And the third one, wrongly believing that others are trying to harm you, means if you have this feeling that other person is going to harm me, but actually he is not, so you are in psychotic depression. A combination of antidepressant and antipsychotic drugs can treat psychotic depression. ECT may also be an option. The third one is postpartum depression. Women who have major depression in the weeks and months after childbirth may have postpartum depression. Antidepressant drugs can help similarly to treating major depression that is unrelated to childbirth. The seventh one, premenstrual dysphoric disorder, which is also called PMDD. Women with PMDD have depression and other symptoms at the start of their period. Besides feeling depressed, you may also have mood swings, irritability, anxiety, trouble concentrating, fatigue, change in appetite or sleep habits, feelings of being overwhelmed, antidepressant medication or sometimes oral contraceptives can treat PMDD, means premenstrual dysphoric disorder. The eighth one, situational depression. This is not I think this depression is too much common, this situational depression, according to my views, because this is not a technical term in and in psychotherapy. You may have a depressive mood when you are having trouble managing a stressful event in your life, such as death in your family, a divorce, or losing your job. Your doctor may call this stress response syndrome. Psychotherapy can often help you get there. Treat about treat about a period of depression that's related to a stressful situation. Atypical depression, the last one. This type is different than the persistent sadness of typical depression. It is considered to be specifier that describes a pattern of depressive symptoms. If you have atypical depression, a positive event can temporarily improve your mood. Other symptoms: increased appetite, sleeping more than usual, feeling of heaviness in your arms and legs, oversensitive to criticism. So these all were the types of depression. I hope you have uh, gained much from this types of depression. And if you have any question regarding types of depression or regarding depression topics, symptoms of depression, and causes of depression, you can freely ask in comment section. But I have already uploaded depression and symptoms of depression in men, women, and children, and causes of depression. The link is in the description. Please watch that video as well. And if you like this video, like it, comment it, and share, and do subscribe my channel for the latest videos about other interesting subjects. Thanks for watching. Allah Hafiz.